Welcome back to MCQs Master 101. In today's high-yield pediatric nursing review, we're tackling 50 most dangerous child dehydration MCQs. Questions designed to test your ability to recognize early warning signs, identify life-threatening dehydration, interpret clinical findings, and make safe nursing decisions under pressure. These are the types of questions that frequently appear on the Nclex and can challenge even experienced nursing students. Pay close attention to assessment clues, electrolyte changes, fluid management priorities, and pediatric safety principles. Let's begin.
Question 1. A mother brings her 2-year-old child to the emergency department with diarrhea for 3 days. Which finding is the most concerning for severe dehydration? A. Moist mucous membranes. B. Sunken eyes. C. Increased appetite. D. Warm skin. Correct answer, B. Sunken eyes. Rationale. Sunken eyes are a classic sign of moderate to severe dehydration in children. They indicate significant fluid loss that requires prompt assessment. Strategy. Look for physical signs of fluid loss, such as sunken eyes, dry mucous membranes, and poor skin turgor. Question 2. A nurse assesses a dehydrated infant. Which finding requires immediate intervention? A. Wet diaper every 4 hours. B. Capillary refill of 5 seconds. C. Active play behavior. D. Strong cry. Correct answer, B. Capillary refill of 5 seconds. Rationale. Delayed capillary refill indicates poor tissue perfusion and possible severe dehydration. This can quickly progress to shock if untreated. Strategy. Capillary refill greater than 2 seconds is abnormal in children. Question 3. A child with vomiting and diarrhea is admitted. Which assessment finding suggests severe dehydration? A. Tears present when crying. B. Normal heart rate. C. Weak, rapid pulse. D. Mustung. Correct answer, C. Weak, rapid pulse. Rationale. Tachycardia with a weak pulse suggests the body is struggling to maintain circulation due to fluid loss. Strategy. Pulse quality often reveals the severity of dehydration. Question 4. A nurse is assessing an infant with dehydration. Which sign is most specific to infants? A. Sunken fontanelle. B. Dry lips. C. Fatigue. D. Idash. Correct answer, A. Sunken fontanelle. Rationale. A sunken fontanelle is a significant indicator of dehydration in infants whose fontanelles have not yet closed. Strategy. Always assess the fontanelle when evaluating hydration status in infants. Question 5. A child weighs 12 kilograms before illness and now weighs 10.8 kilograms. What does this indicate? A. Mild dehydration. B. Moderate dehydration. C. Severe dehydration. D. No dehidración. Correct answer, B. Moderate dehydration. Rationale. A 10% weight loss indicates moderate dehydration and requires prompt fluid replacement. Strategy. Weight loss is one of the most accurate measures of dehydration severity. Question 6. A nurse is caring for a child with severe dehydration. Which assessment finding is expected? A. Bounding pulse. B. Increased urine output. C. Hypotension. D. Moist mucous membrane. Correct answer, C. Hypotension. Rationale. Hypotension is a late and dangerous sign of severe dehydration in children. Strategy. Children compensate well, so hypotension usually means the condition is serious. Question 7. A parent reports that their child has not urinated for 10 hours. What should the nurse suspect? A. Adequate hydration. B. Severe dehydration. C. Normal finding. D. Food intolerance. Correct answer, B. Severe dehydration. Rationale. Reduced urine output is one of the earliest indicators of inadequate fluid volume. Strategy. Monitor urine output closely in pediatric patients. Question 8. Which sign is considered the most missed indicator of pediatric dehydration? A. Dry lips. B. Delayed capillary refill. C. Fever. D. Sneezing. Correct answer, B. Delayed capillary refill. Rationale. Delayed capillary refill often indicates poor circulation and may be overlooked during a quick assessment. Strategy. Always check capillary refill when evaluating a sick child. Question 9. A dehydrated child becomes increasingly lethargic. What is the nurse's priority action? A. Encourage sleep. B. Notify the provider immediately. C. Reduce fluid intake. D. Delay assessment. Correct answer. B. Notify the provider immediately. Rationale. Lethargy may indicate worsening dehydration and possible shock. Strategy. Changes in mental status are red flags in pediatric patients. Question 10. A nurse assesses skin turgor on a dehydrated child. Which finding indicates dehydration? A. Skin immediately returns to normal. B. Skin remains tinted briefly. C. Warm moist skin. D. Flushed chic. Correct answer. B. Skin remains tinted briefly. Rationale. Poor skin turgor reflects fluid volume deficit. Strategy. Tinting skin is a classic NCLEX clue for dehydration. Question 11. Which child is a highest risk for dehydration? A. 12-year-old with a cold. B. 8-year-old with a sore throat. C. 6-month-old with vomiting and diarrhea. D. 10-year-old with a sprained ankle. Correct answer. C. 6-month-old with vomiting and diarrhea. Rationale. Infants have higher fluid requirements and can become dehydrated quickly. Strategy. The younger the child, the greater the dehydration risk. Question 12. A dehydrated toddler has cool extremities. What does this suggest? A. Improved circulation. B. Poor perfusion. C. Fever reduction. D. Normal growth. Correct answer. B. Poor perfusion. Rationale. Cool extremities may indicate decreased blood flow from severe dehydration. Strategy. Think circulation whenever extremities are cool. Question 13. Which finding indicates successful fluid replacement? A. Increased urine output. B. Sunken eyes worsen. C. Heart rate increases further. D. Capillary refilent slow. Correct answer. A. Increased urine output. Rationale. Adequate urine output suggests improved hydration and kidney perfusion. Strategy. Urine output is one of the best indicators of fluid status. Question 14. A nurse notes absent tears when a child cries. This finding suggests A. Normal hydration. B. Moderate dehydration. C. Hyperactivity. D. Respiratory distress. Correct answer. B. Moderate dehydration. Rationale. Absence of tears is a common sign of dehydration in children. Strategy. Crying without tears is a classic pediatric dehydration clue. Question 15. A child with severe dehydration develops altered consciousness. What is the priority concern? A. Shock. B. Hunger. C. Fatigue. D. Sleep deprivation. Correct answer. A. Shock. Rationale. Altered mental status may indicate inadequate brain perfusion. Strategy. Neurological changes often signal worsening dehydration. Question 16. Which assessment finding is most concerning? A. Heart rate 90 BPM. B. Dry mucous membranes. C. Blood pressure below expected range. D. Mid-tierst. Correct answer. C. Blood pressure below expected range. Rationale. Hypotension is a late sign and indicates significant fluid loss. Strategy. Late signs are always the most dangerous. Question 17. What is the earliest sign of dehydration in children? A. Hypotension. B. Tachycardia. C. Bradycardia. D. Cyanosis. Correct answer. B. Tachycardia. Rationale. The heart rate increases to compensate for fluid loss. Strategy. Early compensation usually appears as a fast heart rate. Question 18. A nurse is assessing a dehydrated infant. Which finding indicates improvement? A. Fontanelle remains sunken. B. Increased alertness. C. No urine output. D. Weak pus. Correct answer. B. Increased alertness. Rationale. Improved mental status suggests better perfusion and hydration. Strategy. Watch for improvements in behavior and responsiveness. Question 19. A child has severe diarrhea and vomiting. What is the greatest concern? A. Dehydration and electrolyte imbalance. B. Increased appetite. C. Weight gain. D. Hyperactivity. Correct answer. A. Dehydration and electrolyte imbalance. Rationale. Significant fluid loss can quickly lead to dangerous electrolyte disturbances. Strategy. Always think fluids and electrolytes together. Question 20. A nurse suspects dehydration in a child. Which assessment should be performed first? A. Evaluate circulation and hydration status. B. Check vision. C. Measure height only. D. Assess school performance. Correct answer. A. Evaluate circulation and hydration status. Rationale. ABCs and circulation are priorities when dehydration is suspected. Strategy. Follow the Nclex priority framework. Assess airway, breathing, and circulation first. Question 21. A child with dehydration has a heart rate of 165 BPM. What should the nurse suspect? A. Improved hydration. B. Compensatory response to fluid loss. C. Normal finding. D. Sleep deprivation. Correct answer. B. Compensatory response to fluid loss. Rationale. Tachycardia is an early sign of dehydration as the body attempts to maintain adequate circulation. It often appears before blood pressure changes occur. Strategy. In pediatric dehydration questions, a rapid heart rate is usually an early warning sign. Question 22. A nurse is caring for a dehydrated infant. Which assessment finding indicates worsening condition? A. Increased urine output. B. Strong peripheral pulses. C. Sunken fontanelle and lethargy. D. Moist mucomembrane. Correct answer. C. Sunken fontanelle and lethargy. Rationale. These findings suggest severe fluid loss and poor perfusion. Immediate intervention is necessary. Strategy. When physical signs and mental status both worsen, think severe dehydration. Question 23. Which laboratory result is commonly associated with dehydration? A. Low hematocrit. B. Elevated hematocrit. C. Low sodium from overhydration. D. Decreased urine-specific gravity. Correct answer. B. Elevated hematocrit. Rationale. Fluid loss causes hemoconcentration, which increases hematocrit levels. Strategy. Less fluid in the bloodstream means blood components become more concentrated. Question 24. A parent reports that a child is extremely thirsty. This finding most likely indicates A. Fluid deficit. B. Adequate hydration. C. Respiratory infection. D. Hyperactivity. Correct answer. A. Fluid deficit. Rationale. Excessive thirst is the body's natural response to fluid loss. Strategy. Thirst is often one of the earliest symptoms of dehydration. Question 25. A child with dehydration has dry mucous membranes and no tears. What level of dehydration is most likely? A. Mild to moderate dehydration. B. Fully hydrated. C. Overhydration. D. No fluid déficit. Correct answer. A. Mild to moderate dehydration. Rationale. Dry mucous membranes and absence of tears are classic signs of dehydration. Strategy. These clues commonly appear in Nclex questions involving pediatric dehydration. Question 26. A nurse notices that a dehydrated child becomes irritable. What does this indicate? A. Improved condition. B. Neurological effect of dehydration. C. Normal behavior only. D. Ng. Correct answer. B. Neurological effect of dehydration. Rationale. Irritability is often an early neurological sign of dehydration in children. Strategy. Behavioral changes are important indicators of worsening hydration status. Question 27. Which assessment finding best indicates adequate hydration? A. Urine output less than 1 milliliter per kilogram per hour. B. Dry lips. C. Moist mucous membranes and normal urine output. D. Délai de capillary refil. Correct answer. C. Moist mucous membranes and normal urine output. Rationale. These findings indicate sufficient fluid balance and tissue perfusion. Strategy: urine output and mucous membrane moisture are key hydration indicators. Question 28. A child with severe dehydration develops weak peripheral pulses. What is the nurse's priority concern? A. Shock. B. Hunger. C. Fatigue. D. Sleep disturbance. Correct answer: A. Shock. Rationale: weak pulses suggest poor circulation and possible progression to hypovolemic shock. Strategy: weak pulses plus dehydration should immediately raise concern for shock. Question 29. A nurse is assessing a dehydrated toddler. Which finding requires immediate reporting? A. Slight thirst. B. Dry lips. C. Altered level of consciousness. D. Mild irritability. Correct answer: C. Altered level of consciousness. Rationale: changes in consciousness may indicate severe dehydration and decreased cerebral perfusion. Strategy: mental status changes are high-priority findings. Question 30. Which child is at greatest risk for rapid dehydration? A. 14-year-old athlete. B. 10-year-old with a cold. C. 4-month-old infant with diarrhea. D. 12-year-old with a headache. Correct answer: C. 4-month-old infant with diarrhea. Rationale: infants have limited fluid reserves and higher metabolic rates. Strategy: younger age equals greater dehydration risk. Question 31. A dehydrated child has a capillary refill time of 4 seconds. What does this indicate? A. Normale circulation. B. Poor perfusion. C. Improve hydration. D. Fever. Correct answer: B. Poor perfusion. Rationale: delayed capillary refill is a sign of reduced blood flow to tissues. Strategy: greater than 2 seconds is considered abnormal. Question 32. Which symptom is considered a late sign of pediatric dehydration? A. Thirst. B. Dry mouth. C. Tachycardia. D. Hypotension. Correct answer: D. Hypotension. Rationale: blood pressure often remains normal until dehydration becomes severe. Strategy: late signs are more dangerous because compensation is failing. Question 33. A nurse is evaluating treatment effectiveness. Which finding is most reassuring? A. Urine output increasing. B. Persistent lethargy. C. Continued dry mucous membranes. D. Sunken eyes worsening. Correct answer: A. Urine output increasing. Rationale: increased urine production indicates improved kidney perfusion and hydration. Strategy: adequate urine output is a positive sign. Question 34. A child with gastroenteritis is at risk for dehydration primarily because of A. excessive fluid loss. B. increased appetite. C. Improved circulation. D. better metabolism. Correct answer: A. excessive fluid loss. Rationale: vomiting and diarrhea result in significant loss of fluids and electrolytes. Strategy: gastrointestinal losses are a common cause of dehydration. Question 35. A nurse notes that an infant's diapers have remained dry for several hours. This finding suggests A. adequate hydration. B. fluid volume deficit. C. normal growth. D. hyperactivity. Correct answer: B. fluid volume deficit. Rationale: decreased urine output is a key sign of dehydration. Strategy: always ask about wet diapers when assessing infants. Question 36. A child is receiving 4 fluids for dehydration. Which assessment finding indicates improvement? A. capillary refill less than 2 seconds. B. increasing lethargy. C. weak pulse. D. dérèglement mucomembrane. Correct answer: A. capillary refill less than 2 seconds. Rationale: improved circulation is reflected by faster capillary refill. Strategy: better perfusion usually means treatment is working. Question 37. A parent reports that their child cries without tears. What should the nurse suspect? A. severe or moderate dehydration. B. adequate hydration. C. eye infection. D. normal growth. Correct answer: A. Severe or moderate dehydration. Rationale: lack of tears is a common sign of significant fluid loss. Strategy: crying without tears is a classic Nclex clue. Question 38. Which finding is most consistent with hypovolemic shock? A. Strong pulse and alertness. B. Cool extremities and hypotension. C. Increased urine output. Des moist mucomembrane. Correct answer: B. Cool extremities and hypotension. Rationale: these findings indicate severe circulatory compromise. Strategy: shock signs always require immediate action. Question 39. A dehydrated child becomes increasingly sleepy and difficult to arouse. What should the nurse do first? A. Continue observation. B. Notify the provider immediately. C. Encourage oral fluids only. D. Delay assessment. Correct answer: B. Notify the provider immediately. Rationale: decreased responsiveness may indicate severe dehydration or shock. Strategy: changes in consciousness are emergency findings. Question 40. A nurse is teaching parents about dehydration prevention. Which statement indicates understanding? A. I will wait until my child becomes lethargic. B. I will offer fluids frequently during illness. C. I will avoid giving fluids during diarrhea. D. Urine output does not matter. Correct answer: B. I will offer fluids frequently during illness. Rationale: frequent fluid replacement helps prevent dehydration. Strategy: early hydration prevents complications. Question 41. A dehydrated child has sunken eyes, weak pulses, and hypotension. These findings indicate: A. Mild dehydration. B. Moderate dehydration. C. Severe dehydration. D. Recovery phase. Correct answer: C. Severe dehydration. Rationale: multiple signs of poor perfusion indicate advanced dehydration. Strategy: when several severe symptoms appear together, think severe dehydration. Question 42. Which electrolyte imbalance commonly occurs with dehydration? A. Sodium imbalance. B. Increased calcium only. C. Increased iron only. D. Low cholesterol. Correct answer: A. Sodium imbalance. Rationale: significant fluid loss often affects sodium levels. Strategy: electrolyte disturbances frequently accompany dehydration. Question 43. A child with dehydration has cool, mottled skin. What does this suggest? A. Improved circulation. B. Poor perfusion. C. Normal finding. D. Fever reduction. Correct answer: B. Poor perfusion. Rationale: mottling indicates inadequate blood flow to peripheral tissues. Strategy: skin changes often reveal circulation problems. Question 44. A nurse notices rapid breathing in a severely dehydrated child. What is the most likely explanation? A. Compensation for metabolic imbalance. B. Improved hydration. C. Hunger. Des sleep deprivation. Correct answer: A. Compensation for metabolic imbalance. Rationale: the body may increase respiratory rate to compensate for acid-base disturbances. Strategy: severe dehydration affects multiple body systems. Question 45. A child has vomiting, diarrhea, and decreased urine output. Which finding should the nurse monitor most closely? A. Perfusion status. B. Hair color. C. School performance. D. Favorite food. Correct answer: A. Perfusion status. Rationale: maintaining adequate circulation is the priority. Strategy: focus on circulation in dehydration questions. Question 46. A nurse assesses a child whose skin remains tinted after being pinched. What does this indicate? A. Adequate hydration. B. Dehydration. C. Overhydration. D. Normal skin elasticity. Correct answer: B. Dehydration. Rationale: poor skin turgor is a common sign of fluid deficit. Strategy: tinting equals dehydration. Question 47. Which assessment finding indicates the greatest improvement? A. Urine output returns to normal. B. continued lethargy. C. Dry mucous membranes remain. D. Dilated capillaries refilent. Correct answer. A. Urine output returns to normal. Rationale. Normal urine output reflects adequate kidney perfusion and hydration. Strategy. Urine output is one of the best indicators of recovery. Question 48. A nurse suspects hypovolemic shock in a child. Which symptom is expected? A. Bradycardia initially. B. Hypotension and weak pulses. C. Increased urine output. D. Moist mucomembrane. Correct answer. B. Hypotension and weak pulses. Rationale. These are classic signs of shock due to severe fluid loss. Strategy. Think circulation problems when assessing shock. Question 49. Which child should the nurse assess first? A. Child with dry lips. B. Child with mild thirst. C. Child with lethargy and delayed capillary refill. D. Child requesting water. Correct answer. C. Child with lethargy and delayed capillary refill. Rationale. These findings suggest severe dehydration and possible shock. Strategy. Prioritize the child with signs of poor perfusion and altered mental status. Question 50. A dehydrated child develops hypotension, weak pulses, and decreased responsiveness. What is the priority nursing action? A. Immediate emergency intervention and fluid resuscitation. B. Encourage sleep. C. Delay treatment. D. Offer solid food. Correct answer. A. Immediate emergency intervention and fluid resuscitation. Rationale. These findings indicate life-threatening hypovolemic shock requiring urgent treatment. Delays can result in organ failure and death. Strategy. Hypotension plus decreased responsiveness equals emergency care immediately.
Great job completing these 50 most dangerous child dehydration MCQs. If you found this review helpful, don't forget to like, subscribe, and turn on notifications so you never miss our latest Nclex practice sessions. Remember, in pediatric dehydration questions, always focus on airway, circulation, hydration status, urine output, mental status, and signs of shock. Mastering these concepts can significantly improve your Nclex performance. Comment below with your score out of 50 and let us know which question challenged you the most. Thanks for watching MCQs Master 101. And as always, keep studying smart, stay confident, and we'll see you in the next Nclex review.